Well, welcome everyone to the Aurora Health Alliance Social Determinants of Health Interest Group meeting. I am Tessa Carlson, one of the co-chairs for this group, along with Julia. I am with the Office of Diversity, Equity, Inclusion, and Community Engagement at CU Anschutz. All right, well, thank you everyone for being here. So we'll go ahead and jump into our presentation.
We are BChart Aurora, and we're a sister organization to the BChart of Colorado. We provide community-based health education services in Aurora proper, focusing on the northeast and northwest side of the city, and the far northeast in Denver, and South Adams County, primarily Commerce City. Our educators include Sheila Morgan, as we said, from Children's Hospital, and Hema Chacon, who is our bilingual Spanish community educator, health educator, and myself. As Dionisia was saying, I do have a background in social work. I'm primarily interested in doing this project because it fits with what I do with my PhD work, which is equity, diversity, and inclusion in the health equity realm. And so what we've been doing is trying to talk to people about what is health education, specifically as it relates to addressing equity issues in our community. So Health and Human Services has this leadership plan that addresses a lot of those areas of health and well-being. BChart Aurora specifically functions around right now COVID-19. We pulled information from the National Center of Biotechnology information because it's important to recognize that part of what we do is to provide as accurate as possible, health information, and today it's around COVID-19. So the BChart of Aurora is our COVID-19 response to, as Dionisia was saying, the BIPOC community. And so we engage in a variety of community outreach events, specifically to do health education around COVID-19 and to address the issues of vaccine hesitancy. So in Aurora, what that means is we are working primarily with the churches that have a Spanish-speaking congregation and other organizations that we can partner with to provide this service in that community. Because as you know, based on health equity, health information, the largest numbers of vaccine hesitancy appear in the BIPOC community. And so our agenda right now is to take a look at what is that about and to provide adequate information in public settings, because we want to be what they call that trusted voice in our community. And so we've been working also, we have a project that we're going to kick off next week with working with New Americans. There is a week-long festival that we're going to participate in to provide information in at least Nepalese and Bhutani, in Bhutan, those languages. And then as we expand beyond that, because it's going to be an open festival, we'll be able to provide that information to a broader sense of our community. We also work very closely with the schools because especially Aurora has a newcomers health office, and so they provide a lot of work services to students and families who live in the northeast, northwest quadrant of Aurora. The second thing is that we're also beginning to work with the Asia Pacific Development Center just to be able to provide ongoing support as it relates to increasing the number of individuals who are going to be vaccinated. That's really our presentation. Do you have any specific questions? Want to thank Rich for his assistance on his request for us to participate with the programming in the Catholic churches. And so we're going to be focusing on the parish here in Montbello and in the southern part of Adams County. And then we're going to do backup for him in the four churches in Aurora. And then we are specifically reaching out to QRDRs, and we have a call into their their priest. He's on vacation right now, but as soon as he gets back in town, we will verify a time to come out and kind of talk to folks. Any other questions?
Thank you, Jackie. I do have kind of a two-part question.
Okay.
So I guess what would you say the biggest challenge you all face is, and how, is there a way that organizations or community members could be supportive of the work?
I think two ways. One is just to refer people to us and to say, so that we can develop that reputation of being a trusted voice in the community. And two, because we are a part of Aurora Health Alliance as well, and the Tri-County Health Office, we just refer to us. If you know, or you come across individuals that are from the BIPOC community and they are just being really resistant, it is, you need to just give us a call. That information, I thought Dionisia had provided it, but I can put it in the chat before we leave. But the bottom line is, it's just really going to be important to be a trusted voice. We're hearing every day lots of stories about what are people really hesitant about. What does vaccine hesitancy really look like? And bottom line, especially in BIPOC communities, and we understand this, the bottom line is that the long history of medical apartheid in America has really negatively impacted this particular issue. And we just have to get past that. And the only way we're going to be able to do that is to have conversations. It's going to be really important that we have those one-on-one. Let's talk about what you're really concerned about. I mean, the bottom line, Rich and I talked at length about the idea, why is it an issue in the Catholic Church? Well, the Pope has not said one way or the other. The archbishops in the United States have said that, especially the Johnson & Johnson vaccine, because it allegedly has a human-based product that they have in the last year kind of backed away from any of the vaccines because their perception is that it violates their basic religious tenets. And so we are spending time engaging people in those very honest conversations about, well, these other two vaccines don't have that. And we still have this issue. We're talking about individuals who are marginalized in terms of healthcare, in terms of issues of ongoing racial bias and stress. And so we want to use these opportunities to improve that vision of what they see, what people see as our health system in America. And so that's what we're working on. And that's part of how you can do that.
And let me just piggyback on that. If any of you guys are part of a parish, whether Catholic or Protestant, we're focused on Catholic right now, but Protestant also, that has BIPOC parishioners, good quantity of them. A lot of the Catholic churches in North Aurora and Commerce City are Latino. Curly ours is primarily a Black American church. But and I think Jackie says she knows parishioners that go to Curly ours. But if any of you are part of a parish that is BIPOC or has a lot of folks there, or you know folks who go to those parishes, let Jackie and I know about it, if they would be willing to intercede to the pastor. Now, it's one thing for me, I'm Catholic, to go, for instance, into Queen of Peace. I'm not a parishioner there. I wouldn't be given much of the time of day. But if you're a parishioner there, then the pastor will pay attention if the issue of vaccination is important. What the Archdiocese has said is that while all the bishops have been vaccinated and the Pope has been vaccinated and the Pope Emeritus has been vaccinated, you out there in the parishes use informed judgment as to whether you should be vaccinated. But the message is not coming from pastors of why it might be important to be vaccinated. So that's what Jackie and I and others are trying to do. with pastors who are maybe kind of hesitant to advocate for vaccination or to support a true informed judgment, which means, yeah, you say, yeah, there's a remote linkage to fetal cell research with Pfizer and Moderna, but at the same time, they're approved, they're morally approved if in the defense of life. And in our country, so over 600,000 people have died from COVID. So that should lend into informed judgment. See, that's not coming from our parishes. I don't know about the Protestants, but from our Catholic parishes, most of them, you don't hear that. You don't get information that'll help you in an informed judgment. So back to Tess, you asked, how can people help? If you're part of a parish, or you know people who are part of a parish that has BIPOC folks, then you'd be willing to go with us to the pastor and be a parishioner that says, hey, pastor, yeah, maybe we should look at both sides. Then see Jacquie and me, and that would be really helpful for our churches here, especially North Aurora, Commerce City area. Okay.
I have a question on, would you like the BChart referrals to be more like organizations, like bigger community outreach items, or like I'm looking at my neighbor across the street who's waiting to see how vaccines go? Is it individual folks?
Specifically individual folks, because we want to have that one-on-one conversation. We want to ask those questions about where does this hesitancy come from? And, when we're talking about waiting to see where it goes, well, we know where it's going. We have 2 variants that are prevalent today. So, the question becomes, what is the bottom of your concern? And how do we address that? I think the question that you're asking is, so how do we do that? From the clinical perspective, we use motivational interviewing. We want to talk about, well, how can we mediate what some of your concerns are? How can we address that? And that's specifically what that conversation is. So it's not specifically to address organizations. It is absolutely to have one-on-one conversations with individuals. Because we really think that's where that's going to happen.
I think you all do such valuable work. I'm so grateful.
Thank you.
I sometimes get so excited I start brainstorming, and I'm kind of swirling in a brainstorm on people, in my neighborhood contacts that I have that you might.
Maybe you can do a small block party.
Yeah.
If it's
because I'm immunocompromised, and if it's for unvaccinated folks, I'm not interacting very much with unvaccinated folks. It's so challenging.
Well, and I understand that because I'm immunocompromised also. Yeah. And I definitely understand that. But, that's why we can have that one-on-one conversation by phone. You can certainly give them this number. Let them know that there are people willing to have the conversation with them. And also, we're not interested in convincing them. Mm-hmm. We just want to talk about, what is your vaccine hesitancy? Where is that really coming from?
Has there been anything, sorry, I'm kind of commandeering questions. Has there been anything surprising that you all have unearthed in these conversations so far?
No, I'll be honest with you. In the BIPOC community, it is specifically related to medical apartheid issues. It is specifically related to the historical, issues of racism in medical care in the United States. That's everything that we've heard. And we have these same kind of answers. This is the bottom line. What do we need to do to reduce your anxiety about this? Because we have 2 facts. One, this is a serious illness. It doesn't appear to be going away by virtue of the fact that it has mutated at least twice. Second, we know that individuals specifically those who are immunocompromised, fare better after the vaccine, even if they get exposed. And we do know that. We know that in the United States right now, the people who are dying are people who have refused to take the vaccine, period. The numbers, and I just read it this morning, the numbers of individuals who are dying or having worse symptoms following exposure to COVID are individuals, once again, who have not taken the vaccine. People who've taken the vaccine have had fewer challenges, fewer social emotional challenges. And what we're seeing is quite possibly even fewer of those psychosocial challenges, because we understand that secondary to COVID, there is a major psychological response. There's something that does impact cognitive functioning. People talk about having a brain fog, and that's not uncommon, but they don't have it as bad with the vaccine. And so, that, like I said, really what we're finding is this conversation has to come around to, so what are we going to do about it? And how are we going to change that and change people's anxiety about it? Especially in the BIPOC community, where people are their primary argument is, look what happened in Tuskegee and with Native Americans. Look what happened when they were exposed people to smallpox. We understand that. We do understand that. And more than anything, I empathize with that. And it doesn't change the fact that, one, if you take the shot, you'll have fewer symptoms. Two, if you take the vaccine, not just the shot, but the vaccine and the series, you're less likely to contract the virus. And if you do, you're less likely to suffer. And then I go with the social emotional argument. This is not the time in the United States when you want to be away from family and friends. And we know that people who are negatively impacted by this virus ultimately suffer alone. And that is the most horrible piece of this. So how can we have this conversation to reduce your anxiety and increase your willingness to take the vaccine?
I have another question for you, Jackie.
Sure.
Are you, because I heard you say you're not trying to, change minds or convince people to get the vaccine, but really just address those anxieties. Are you following up with folks after you've had an initial conversation to see if they did decide to get the vaccine?
Absolutely. Absolutely.
And have you been seeing some people kind of shift their perspective a little bit, or?
Yes, we have. We've seen people become more willing to take it, because ultimately, this is our plan. Introduce yourself to someone, determine if they've taken the vaccine. If they haven't taken the vaccine, determine what their hesitancy is. If they are just in the 10 or 15 minute conversation or absolutely still not willing to do that, then there's a follow-up conversation in about 10 days. And that conversation is, okay, so what else can we do? I can give you all the data. I can talk to you about your anxiety. We can talk about what else you're doing to protect yourself. And what can we do right now to help you make this decision?
Thank you. Does anyone else have any questions?
I have a quick question. How are you suggesting people on the referral end kind of bring that up to people of, do you want to talk to this group that is interested in your hesitancy? I'm just trying
Brainstorming
to how that conversation would go.
Right. Well, I think I would look at it. I'm going to give you information from like the social work perspective. You're working with clients in whatever capacity, and the question comes up, and it should come up because you're all kind of either in the medical field or affiliated in the medical field. So have you taken the vaccine? Yes or no? This is, this, and if you haven't taken the vaccine, are you open to talking about what your concerns are? And if they are willing, then this is when you said, so there's some folks that we work with that would be more than happy to talk to you about this. Over and above talking to your physician, because that is the other piece. We are very, very concerned that the numbers of people who are so resistant are folks who are quite frankly not necessarily health compliant, period. So that becomes part of the broader conversation. And then you focus down in on actual discussion about, have you had the COVID-19 vaccine? Because what we're understanding is that there are higher numbers of people with respiratory challenges, higher number of people with a history of diabetes and cardiac illness, higher numbers of people, quite frankly, who may well have some social emotional challenges, who are just not health compliant across the board. And so getting their physicians even to reach out to them is a whole nother ballgame. So that becomes part of the issue. How do we get people to be, especially in the communities that we're working in right now? This really is about health compliance across the board.
Thank you so much. Does anyone else have a question for Jacquie?
So definitely talk to your friends and families in this business. If they have folks that are actually verbalizing some hesitancy, please give us a call. Like I said, we're not here to try to convince people. We're here to try to reduce some of that anxiety and those fears.
Thank you so much. We really appreciate it.
Thank you. Y'all have a good one.
You too, Jacquie.
Hey everyone, I'm Dionisia de la Cerda. I have a few things that I work on the campus, but I try to show up as a community member. So I just wanted to give you a little bit of background about BChart Aurora, and then talk about Pandemic of Love. So I think I'm going to start with Pandemic of Love just to kind of keep the flow of things. Let me share my screen. Let me figure out which, sorry about this. Technologically challenged this morning. Hold on, that's not the one. So Pandemic of Love was founded by a woman named Shelley. This is Shelley. Oh, am I sharing my screen? No, I'm not yet. Hold on. In the early part of the pandemic, back in March of 2020, she was seeing that there were a lot of people that were in need and a lot of her friends that were wanting to help. And so she put two forms out, one that said give help and one that said get help. And she went to bed that night. And when she woke up in the morning, there were 500 people on 400 people on that had filled out the form to get help, but there were 500 people on the form to give help. So her and her friends, they spent time matching people. And I'm going to drop a few links you guys can look at when you have time. That she was on the Kelly Clarkson show. There's a website that they use. But the beauty of the project is that it's now international, but there's local sites across the country. And Tessa and I, in September of 2020, decided to open a Aurora chapter specifically. And can you guys see my PowerPoint? Am I sharing my whole screen or just my?
It's just the Pandemic of Love website is what I'm seeing.
Okay, let me share one more time. Sorry about this. I'll get there eventually. Okay, so let me just try to make this, because I just want to show the one page. Oh, I just have one page to talk about Pandemic of Love Aurora. I will tell you that when we started in September, we had a steady flow of people asking for help, and we've always struggled with local donors in Aurora to give help, but we had a decent matching, and then the national team would do what they call a donor drop, where she was getting like national attention, and she would just give us a bunch of donors that then we could reach out to, even if they weren't in the community. And we kept at a steady pace through the end of the year. And then Colorado Access was kind enough to give us a $10,000 donation right around the end of the year. And that's helped keep us afloat. Through the holidays, we were really had a steady flow. But I would say since January, February, it's gotten very quiet, both on the donor side and on the people in need side. And I don't know if that's fully because people, like, definitely when stimulus checks came, we had a couple people that got a stimulus check and wanted to share it. And then also I think that gave some people relief. But also we're not like during the holidays and towards the beginning of the year, we really had like funds to really kind of help people with like paying their rent or paying back rent. And we don't have those kinds of funds anymore. So we're seeing more and more, we're seeing repeat folks that are, kind of consistently struggling. And we have a diaper list, which if we get the mom's name and the size of the diapers, we can put that on the national list. And then every week Shelly posts that on her Instagram, and she usually gets our moms adopted weekly. That's also been slowing down. I say all that to be very transparent. I'm kind of at a crossroads whether if we're gonna continue to connect people, or if it's time to, this method isn't useful for the community anymore. And so that's why I partnered with BChart Aurora as another way, especially for our folks that are like coming back to us regularly, really getting them plugged into the community in a way that they get more support than what we're set up to do. The way the Pandemic of Love works, and the beauty of it when it's done well, is that the goal isn't to like save someone from everything that's going on. The goal is just to take a little moment of kindness and give someone that has an extra $100 connected with somebody that just needs an extra $100. It's not meant to be a repeat process. And so once we start getting repeat processes, we have to think about how to get people plugged into professionals who can help with more long-term resources and care. I added a couple of slides a couple little bit of notes on, Tessa has been doing a great job of like, we are going through our donations and kind of doing some stats. And these are my kind of quick numbers. With the Colorado Access money, we were able to do like bigger things like pay someone's rent, but typical donations nationally are more like $50 to $150 range. This isn't meant to be a big sweeping, payoff. It's just meant to kind of give some people relief. And what I always tell people is it's more about, especially in the heart of the first wave of the pandemic, was just to kind of give people hope and let them know that like there were community members that cared and wanted to see them, thrive in this world. And so, does anybody have any questions about Pandemic of Love? That's kind of the quick overview of Pandemic of Love. Nothing?
How would you like community organizations such as Aurora Health Alliance to help spread the word?
Well, so, Tessa and I have really had a hard time finding volunteers. So it's been her and I from the start. And then, so if anyone is interested in kind of getting involved in this, we might be able to amp up some social media presence and get more donors. We've really struggled to get donors. We have a handful of regulars and a few people that'll come along the way, but we just aren't consistently giving donors. The other thing, and that's what I'm working on with Jackie, is partnering. We really, Tessa and I set out at the beginning not to be, not to just be mucking things up by helping someone and sending them on their way, but really kind of partnering with community organizations that could do more wraparound support. So if there's community organizations that would like to be involved in that, because I can tell you, I often call Rich or I pick Jackie's brain about like, hey, I have this mom, she's got 4 kids. She doesn't seem to be plugged into like a church or a community organization. Who would be a good person to, connect her to? So any of that, and you can email me at that pandemic pol.aurora.co@gmail if you have any ideas or interest in doing that. We've had a couple of people that offered to be referrals, and sometimes that worked out well. And then other times we would send people to them and then we wouldn't hear any follow-up, but then hear from the community member maybe like a month or 2 later. So it's been challenging. Any other questions? Okay, I'm gonna move on to the BChart. So BChart stands for Black Community Health Awareness Response Team. And in March of 2020, the Colorado Black Health Collaborative hosted a discussion with leaders in the Black community, a small group of people looking at how to address COVID and beyond. I just need to get the page open up. So I want to be clear that I am the only non-Black person on this group. And I'm fortunate enough to be part of the team, but it is a Black-led initiative. So these are the leaders that got together: Dr. Richards, Dr. Terry Richardson, who recently retired, Thelma Craig, Sheila Morgan, who works at the Children's Hospital, Dr. Carol Watkins Ali from the Greater Denver Interfaith Alliance, Tracy Randall, she's with blackdoctor.org, and then Ayanna Johnson recently graduated from the University of Colorado, Northern Colorado. And so the BChart stands for Black Community Health Awareness Response Team. What I want people to focus on is the R. What we wanted was, there's lots of folks that want to, especially post George Floyd, there's lots of folks that want to talk to the Black community because they read about it, or there was a news article, or they have things to say. There's lots of folks that want to get information from the Black community because it checks a box, or they're gathering information for a grant. But that responsiveness was important to us. And what Regina and I were seeing was that people were trying to communicate to the Black community, but like when they would say, oh yeah, we put together a flyer and you can use it for your door-to-door stuff, it would be like 8 pages long, or there'd be a long website. It was just like bombarded with information. And so we wanted to work on something that was more digestible and more easy to understand. And over time, it evolved. Denver Health ended up funding some BChart educators for their footprint, and those educators kind of were already embedded in the community, so they had kind of their own phone numbers, but then they also show up at various education events. And so Regina and I really wanted to start something in Aurora specifically. And because Aurora is so diverse, we decided to expand the B of BChart to be Black, Indigenous, people of color, immigrant, asylee, refugees, like more broadly what the B stands for. And so we spent a lot of time trying to get some people together. We brainstormed on how we could do it ourselves. And so I had 2 volunteer students, and we had a medical director of Salud saying that they wanted to help us. And so we just decided to try. And I remember one meeting, we were just like, well, we're going to set something up. And if we get flooded, then maybe that'll be a reason that we can get some funding. We didn't have any funding at that point. And then fast forward, I don't know, 3 to 6 months, we got an opportunity to apply for Together We Protect through the Caring for Colorado Foundation, and we're funded. And so we have been talking to Jacquie Stanton because we really want BChart educators in Aurora. We really want it to be a model that we're not here to like create a program that solves all the problems. We really want to supplement and complement things that are already being done out there using educators that are in communities that you're working with. And so Jacquie has a background in social work, and so she's helping us build like a social work model that somebody could come and have a question about the vaccine or about getting rent assistance, but we could have a little bit of more questions and wraparound support that then we could get them plugged into other resources in the community. And so I'm going to give you just a little bit about what Jacquie's doing, some of the work that we're doing, and then I'll give it to her to do her presentation. So, and Sheila Morgan is on. She's a BChart educator. Hi, Sheila. And I don't think any of the other educators showed up. So a couple things that we're doing right now is we're working with Rich and Colorado Access and Tri-County Health around Spanish-speaking Catholic community, the Spanish-speaking Catholic community. And again, we're not here to like solve the problem, but to show up and see how we can help. So we have a BChart educator that's bilingual and very connected to the Spanish-speaking community. And so she's helping with that. And we are also partnering with Jeannie Dixon with Children's Hospital to see how we can work together around the Black Health Initiative through the Children's Hospital. And so Jacquie has been there since last year sometime. She has been showing up and trying to help us figure this out. And so we're very grateful that we were able to bring her on officially and have her help us build out this program.
Well, I think we all have about 12 minutes back in our day then. Thank you all so much for joining us. And we hope to see you in a couple months.